Hi, my name is Susan Mingle. I'm a clinical nurse educator for Med1 Group, and I'm here today to provide a demonstration on the ICU Medical Plum 360 device. It is a smart pump, meaning that you can have your hospital's customized formulary uploaded into the device via the MedNet Safety Software. This safety software will prevent IV programming errors at the bedside. Some of the unique features of the Plum 360 are you can have what's called a clinical care area, up to 40 of these. And an example of that is critical care, med-surg, labor and delivery, and they're each customized with limits per the drugs that are in those CCAs. The limits can be hard or soft, and we'll talk about that a little bit later. And each CCA can have up to 400 drugs. Another unique feature is what's called concurrent delivery. This is the only device that can provide that. Concurrent delivery means that you can actually have two medications running at the same time using only one tubing. It also can provide syringe delivery. Syringe sizes are 3 up to 60, and the syringes can also be used to back prime any air that may have come during the infusion. The flow rate ranges are 0.1 to 999, and the device weighs 10 pounds. So now we're going to talk about the physical features of the device. On this side, you have tubing line guide A, tubing line guide B, and this pink note, caution note, warning note, is just making sure that before you open the lever, you're going to want to make sure that all your line clamps are closed on the distal side of the tubing. So you unlock the lever by pulling up, and then you will be inserting what's called a cassette-based tubing. This is proprietary to the Plum 360 device, but it's also the cassette that allows concurrent delivery to take place. The other little cautionary tape that's up here is just to make sure that you close the lever when it's not in use. And we'll be talking about the tubing and priming and loading in just a little bit. So moving over to the area where the LED screen is located, you're going to see these soft keys here. The green is your start. The red is your stop. This plug indicator that's lit right now is just to let you know that the device is plugged in. When it's unlit, it just means that device is unplugged. We recommend that you plug it in at all times. The blue button is your on-off. The yellow with the C is clear. There's your decimal. And this is your alphanumeric keypad. And this is your lockout with the little key here. You'll be provided a code that you can use to lock out the panel. And the only thing that works when you're in lockout is the stop button. To unlock it, you'll press any button on the keypad and you'll put in that same code. These are select keys that will help you move up and down throughout the programming, and we'll show you that a little bit later. Underneath here is where the battery is housed. A fully charged battery is anywhere from 4 to 7 hours, and that depends on your rates of flow. So the higher the flow rate, the more the battery is going to be depleted. So again, we want to recommend that you always keep it plugged in. Up here at the top are what's called flow indicators. When you are infusing, these will be blinking, making you know that something is running in either one or both of your lines. This is the audio paused key. When there's an active alarm and you press that, it will silence the alarm for up to 2 minutes. If there's not an active alarm and you press it, this will silence any of those noisy key presses that you may hear and you don't want. So I'm going to turn it around and show you some of the items on the back. This is your pole clamp. It's very easily, you just unscrew it and screw it back in. This is your port cover. You just lift this up if you're doing any manual, like uploads to your drug library or downloads of data. This is where you would attach it. This is your audio knob, so you can turn the volume of your alarms up or down. And then this is where your power cord is. So let me turn this back around. And then the next thing we're going to talk about is our tubing. We'll be doing priming and loading the tubing. So now we're going to move into the tubing portion of the demonstration. ICU Medical offers a wide variety of tubing choices. Should you need blood set, pump sets, 1, 2, 3 ports, filter sets, they have pretty much what you would need. So today's demonstration, I'm using a pump set that has 1 port, and the name of their ports, needle-free ports, are called claves. This is for any IV pushes closest to the IV insertion site you may need to administer throughout the day. I have already primed this tubing, but I'll just review that for you. So up at the top of the spike, you'll see there's a vent here. So if you have to do any rigid or glass bottle deliveries, you would just open that to vent. There is a little line on the drip chamber. You will want to fill your fluid up to that line. And then moving on down to the cassette, you'll see that there's also a clave here. When you're doing your priming of the tubing, you want to invert that clave so it's basically below or upside down. And then right here, this knob is called the flow regulator. We're going to pull that out to start our priming. So priming will slowly move down the tubing, up and into the cassette, and once it fills this round portion called the air trap, then you want to invert it again so that your clave is now in the upright position. Fluid will then continue to move down your line, and once it gets to your clave, then you want to tip and tap that port to knock any air that may be in there. And then this protected end cap, it will fill up with fluid so you can keep it sterile until you're ready to hook it up to your patient. So let me show you a little bit about the cassette. I did say that there's a clave on top. You do have your flow regulator, which once you're through priming, you want to push it all the way in so fluid will stop. And then on the back side of this is what's called the finger grip. That's how we're going to load that into the device, and that's what I'll show you next. Next, we're going to be loading the cassette into the device. As I mentioned before, on the back of this, there's what's called the finger grip. So you want to make sure you grab a hold of that, open your lever, and then slide the cassette into the door, close your lever, and now we're ready to program an infusion. Next, we're going to move on to programming an infusion, and we're going to use the IV fluid normal saline. First thing you want to do is place your tubing into the line A tubing guide. We talked about that earlier. And then make sure your safety clamp, which is for additional free flow protection, is in the open position. Now we're going to turn the device on with our blue button, on-off button. It'll run through some diagnostics first. First clinical question is asked, is this a new patient? So looking at your arrow keys, soft keys, you're going to press yes. And then the CCAs, the clinical care areas we talked about, are listed below. This 1 of 3 just means that there's 3 pages of CCAs. For demonstration purposes, we're going to use ICU. So I will use my select keys to scroll down to ICU, and it'll be highlighted. And then looking at the soft keys, right here is where it says choose. So now I'm in the ICU CCA. So I'll reach over with my soft key and select A because that's the line that I have loaded. So the way you access the drugs in this library is you're going to type in the letters that they begin with. So because I'm doing IV fluids, the way this drug library is set up is that because there's multiple line items for IV fluids, normal saline, half normal saline, D5, etc., they're listed as just IV fluid. So I'm going to type in, using my alphanumeric keys, the 4 key, and I'm going to tap it 3 times, GHI, to get to IV fluid. And then it will sort, and it actually happens to be the first one, so I will choose that one. And then now it's telling you that we need to put in our parameters. Rate is highlighted, so I'm just going to do a small rate of 25. And then I'm going to arrow down with my select keys, and I'm going to put in the volume to be infused. And I typically recommend underestimating to like 950, 975, just so you don't run your bag dry. So I'll put in 975. And then it automatically calculates the duration that it will take that to complete. So by doing that, it's telling me in this prompt bar, start to start that infusion, which is your green key right there. So we'll press start. My prompt says yes. Go ahead and press the soft key, yes. And remember our flow indicator here, it's now blinking, indicating that my infusion is indeed running. So now we're going to be programming an IV piggyback infusion. We're going to be using the drug potassium 10 MEQs per the doctor's orders to be infused over an hour. I've already primed the secondary tubing for the piggyback. Just like you squeezed on the drip chamber for the primary line, there is a notch on the secondary tubing for the piggyback. You'll squeeze it till you reach that notch. Then you simply open up the roller clamp, prime till you hit the end with this protected cap. You're going to remove the cap. You're going to swab your clave, and then you're going to push in and then twist to secure it on. That opens and activates the valve. So just like line A, I'm going to thread the tubing into the line B tubing guide. So now I'm going to choose B with my soft key, and I'm looking for potassium, so it's 7. And it's the first letter, so I'm just going to hit that one time for the P drugs to come up. And I'm looking for potassium, so I'll page down because I don't see it there. Page down one more time. And then here's all my potassium, so I'm just going to select key down to my 10 MEQs, and I'm going to choose. And it is in the piggyback mode. However, if you wanted to change it to a concurrent delivery, this is where you could change the mode, and you see it will change to concurrent. So let me go back to piggyback. And because the doctor ordered this 100 to go in over an hour, I'm going to select key down to the volume, which is 100, and then select down to highlight hours, and I'll put 1 in. And then I'm going to press the green buttons. I waited for start to come at the prompt. And then yes to go ahead and start this infusion. So now you see your flow indicator on B is also now blinking. And because it's in piggyback mode, the A is in standby until our potassium is completed. So what I'm going to show you now is what it looks like once this potassium has completed. I did enable the callback, which is configurable. So once this is completed, it'll automatically flip back over to the primary, and it'll give us an alarm letting us know that that has occurred. So there's your alarm. You just want to read your rectangular prompt box that says callback to line B, silence, which you could silence your audio alarm. And now you can see that A is pumping with the flow indicator that is blinking. Okay, so now I'm just going to go to B, select B. I'm going to clear the line settings, say yes. And so now this is grayed out because it's no longer pumping and it's no longer active. Next, I'm going to simulate somewhat of a similar alarm, but we're going to be doing it on our primary line with our normal saline and simulate what it looks like when the KVO alarm is met. So now I want to demonstrate what a KVO alarm looks like. I've manipulated the numbers so that we're almost to the total end of infusion amount. Okay, your KVO is blinking. You see your rate now has changed to 1. That is the KVO rate. VTBI completed. Line A, add more. So I'll press the audio pause, which gives me time to go get my subsequent bag. I'm back with my bag. I take off the old, I put on the new. Select A. I'm still keeping my rate at 25. I'm going to select down, to my VTBI and do 975. Press start and press yes. And so now my next bag is infusing. So next we're going to be doing a syringe delivery, and we're going to be doing it in the concurrent mode. We're also going to be doing a drug via syringe that is not in the drug library. That can happen sometimes, so I'm going to show you what you would do if that happens. Just keeping in mind there are no safety parameters around this particular drug. So let's talk about how we're going to load this. So you're going to swab your clave, just like we did with our Piggyback. We're going to push down, and then we're going to twist. Okay. Next, we're going to select our line B, and we're going to choose, which I said this drug is not in here, so we're going to choose what's called no drug selected. So I will go down on my keypad. This is MNO, so 2 clicks to get the N. And then we'll need to page down. And then we will choose the very last entry, select it down, no drug selected. I'm going to choose. And then these are the different ways it can be delivered. I'm just going to stay with mils per hour and choose that. And then now it's saying Piggyback. Remember I said we're going to demonstrate concurrent for you. So I will need to change that mode. And now it's in concurrent. And then I will go down to the rate. I have 30 mLs in this, so I'm going to be doing 30 mLs over 30 minutes. Type in my 30 minutes, and then it will calculate my rate. Then I'm going to read my box, and it says start. And then I'm going to say yes, I'm ready to deliver. So now that you see by our flow indicators, both line A and both line B are infusing. You'll notice a little caution triangle up here. That's just indicating that you are infusing a drug that's not in the library and that there are no safety parameters around that particular drug. So for our final infusion demonstration, we're going to be doing a heparin infusion. And I'm also going to be demonstrating hitting a hard limit and a soft limit. So I've already got the heparin loaded into the device. So I'm going to go over and select our A. And then we're going to go to the alphabet where we have our H. So it's GHI. So I'll hit 2 times to get our H drugs to come to the front. And heparin just happens to be the first one, so I'll choose it. And you enter the patient's weight up there. That's highlighted in kilograms. And we're just going to say the patient weighs 75. And then I'll select down. And I'm going to start with a dose of 10 units. And then I'm going to put my VTBI in as 250. And then I'm going to press start and yes. Okay, so you can see displayed all on the screen all the parameters that I entered in. So now we're going to demonstrate programming the infusion so that we hit a hard limit and a soft limit. So I'll start with the soft limit first. So we will select A. And let's say I'm going to change the dose to 40. And then I'm going to press start to confirm. Now it gives me a prompt that says the dose is over 35. Are you going to override the soft limit? Well, in this scenario, I'm going to say the doctor gave me an order to give 40 and the patient's lab work warrants that dose. This is where you have that choice of saying yes or no. If I realize that I made an error, then I would say no. I would go back and put in the correct number. But this time I'm going to go ahead and decide to override it, and I just say yes. And then I say yes to start this program in the overrode mode, okay? And now you see this arrow key over here that's pointing up. That's just an indicator to the clinician that you are above the limit for that drug. Next, let me show you a hard limit. A hard limit's a little bit different. So I'm going to put in, this time, a dose of 55, okay? And then I immediately get in my prompt, the max hard limit dose is 50. So you just have to clear that. You can't give that. Anything higher than that, you have to go below that. So I'll go back to our original dose we programmed when we first started to 10. So I'm going to clear. I'm going to put in the 10, and now I'm going to go back and press my start and say yes. So that's an example of a hard and a soft limit. Next, we're going to be talking a little bit about troubleshooting and the alarms on this device. So now we're going to talk about troubleshooting and alarms. The alarms are prioritized into a low, medium, and high category. A high alarm is 10 beeps, a medium alarm is 3 beeps, and a low alarm is 2 beeps. An example of a low alarm would be a low battery. You simply just need to plug the device into the wall. An example of a medium alarm would be the door is opened. Again, you just would need to simply close the door and restart your infusion. An example of a high alarm would be a distal occlusion on the patient side. You basically just need to troubleshoot your line, look for any kinks, and then press restart. Another high priority alarm would be air in line. And unique to this device is the capability to be able to back prime the air out of the line. And I'm going to demonstrate that for you next. This is how you would back prime air in line. So there's a back prime button located here. Just press that key, press and hold until you've resolved and relieved all of the air out of the tubing. And it's all filling back up into that syringe. And then once you've resolved it, you just let go, and then you can remove your air with your syringe. So the last thing I'm going to talk about is settings. So you're going to press this soft key here, and I'm just going to go over a few of these things. It's the end of your shift. You need to see what the volume infused has been, so you can chart that. So it's highlighted. I'll choose it. And it will show everything that was infused on line A and line B, and then it gives you your total volume. So before you clear it, make sure you write that down. So I'll clear that total. So it's new for the next nurse. Then I'm going to scroll down with my key here, and this lighting contrast simply allows you to lighten or darken the screen. So you can decrease the backlight, and you can say done, and then you can go back in to the display contrast, and you can lighten or darken that by decrease or increase the settings. So you can just make the LED screen how you want it, how light or dark you want it. And then the last one is pressure, so you can actually see where the pressure is in PSI. And this is set at 10 PSI for this CCA, which is ICU. And then last, if your patient has, doctor has discharged the patient out of ICU to the Med-Surg, and you want to change the CCA to Med-Surg, this is where you would press change CCA. And then you could move, I'll scroll down once, and then I'll choose Med-Surg. And so if things were still running, everything now will move into the Med-Surg CCA. And then now I'll just go back to my previous screen. So now I want to show you how to power down the device. Remember the blue button down here, you just want to press and hold that, and then just let it go, and it will completely power down for you. This concludes our video demonstration on the ICU Medical Plum 360 device. If you have any interest in renting this device, please visit our website at www.med1group.com. Thank you so much for watching.